you for joining today's virtual session. A few of us are getting quite old hand at these now, aren't we? I can see a few familiar faces now. So yeah, this is the first of, well, the latest of a long number of virtual sessions that we've been doing. And we're really pleased for this one because we know it's such a vital area for so many people in the TSC community. We know that around 8 out of 10 of everyone who lives with TSC also lives with TSC related epilepsy of some form. And that's why we were really delighted to get Lisa O'Brien, who is the head of health at Young Epilepsy, which is a fabulous charity. If anyone is not familiar with them, I've got no doubt most of you are. And yeah, before I hand over to Lisa, I'll just go through some very quick housekeeping. If you've been to a few of these already, you'll probably know what I'm going to go through by now anyway, but I'll do it anyway. So first of all, everyone, when you've joined, you'll be on mute. Just kindly ask that you stay on mute unless you've, of course, got a particular question or whatever else. It just keeps things a bit easier and a bit less messy when there's so many people sort of joining at the same time. Also, do be aware that we're recording this session. If you prefer not to be on the recording or anything like that, that's absolutely no problem at all. Don't let that put you off from joining in, engaging, asking questions and things like that. It shouldn't stop you. All that we ask is after the session, just drop me a line. So just press reply on the email that you will have all received from me, just saying, oh, my name is Joe Blogs. I asked this question at this time, XYZ, and we'll just make sure that you're not on the recording. And other than that, it's just to say that this is very much a safe space, or we hope that you see it that way. Everyone on this call understands the huge impact the TSC can have on not only on individuals but also on families, and also TSC related epilepsy as well. So do please feel welcome. We do encourage people to have the webcams on and things, but if you'd rather, take a step back and just listen to things with your video off and muted without any questions, that's fine as well. It's no problem at all. So yeah, so that's everything from me. Yeah, so now I'll hand over to Lisa, who I can see, thankfully. Hello, Lisa. Hi. So I'll put myself on mute and then hand over to Lisa now.
Hello, everyone. Can you hear me okay?
Yes.
Perfect. It's very weird. I still can't get used to talking to a computer, but so many faces. So do bear with me. Probably technology is not my forte. So I'm Lisa. I'm the head of health. I'm the epilepsy nurse consultant and also the registered nurse manager at Young Epilepsy here in Lingfield in Surrey. I presume some of you will have heard of us and know a little bit about us. So very quickly, because you're not here to learn about Young Epilepsy, we are a education and residential provision for young people and young adults with epilepsy and other related conditions in Surrey. We're also a national charity. So yeah, that's me. So me, epilepsy nurse specialist. I've worked at King's, trained at Great Ormond Street Children's Hospital. I might be a specialist, or that's part of my title. It doesn't mean I know everything. So if you do ask me a question that I don't know, I will go away and I will find it. I love learning, but try not to go out of your way to find something that I don't know. If possible, that would really help. So I've done a very, very short presentation because I feel death by PowerPoint at the moment. Nobody needs that. But ultimately what I wanted, and with other webinars I've done, it's been very much question and answers that you actually want. That's why you're here. You don't want me to talk about things that I want to talk about. You want to know things that you want to know. So We'll open it up after that. I don't know how, Luke, you want to do that with the hand raising or just a general free-for-all. We'll see how it goes.
Generally what we do is I try and manage it, but if anyone does have a question towards the end, do feel free to put it in the chat, or if you're comfortable doing so, you can just sort of either wave physically, or you might see that there's the like the wave function on Zoom, and I'll try and manage it accordingly.
Perfect. Brilliant. Right, we'll get started. This is where it could all go wrong. My sharing screen might not even work, so bear with. Oh, look, there it is. Wrong way, but I might have to go to the beginning. Hold on. Oh. Oh, can you all see that?
Yep, perfect.
How exciting. Right, okay, so that's me. I've already told you. And Luke, as you said before, if you don't want to be filmed, that would be me. If you could cut me out, that would be perfect. Okay,
that's fine.
So as Luke said, 80% of people with TSC are living with epilepsy anyway. So I'm not going to teach you about epilepsy, you know it. I'm just here to talk about epilepsy, the effects like COVID has had on people with epilepsy, and some little kind of ideas around management, little things that we've seen that might help people. So recently, Young Epilepsy have produced a piece of research asking people with epilepsy from all walks of life how they've managed during COVID-19 and lockdown. On a site here, we've kept going throughout the whole of COVID. We've managed to stay open. We've had probably about 70% of our students remaining on site and accessing education, which has been really good. But this was opened up to the wider community, and we had about 300 people respond to our survey around what they'd found, and 30% said that they'd actually had an increase in their seizures during lockdown. What I found initially was that people's seizures actually reduced just for a little while, and I'm not sure if that's because they didn't have anything put on them. There was no stress of going to college, work, school. They were chilling at home, kind of having a nice time, and so we didn't see as many seizures. But as they came out of that first initial phase of that side of thing, and the fear of COVID, the fear of what could happen took hold, hearing everything on the news, as more and more things became unavailable, I think then we did see an increase. Also, the majority of young people with epilepsy reported deteriorations in their sleep and their mood during lockdown, and we know that stress is a real trigger for seizures. Also, mental health issues go kind of hand in hand with epilepsy. So we knew that that was a particular area of concern, and looking at how we manage that and how we support people. Nearly a quarter found that clinical procedures they were due to have, their investigations, were cancelled during lockdown. Initially, everything stopped, so there was no outpatients appointment, there was an emergency service, and having accessed emergency care myself, I got trampled by a horse, but that's another story, we don't need to go in that now. The A&Es were actually really quiet during this time. That could have been people were just really reluctant to go to hospital themselves for the fear of actually contracting COVID. And also everywhere else, I know a lot of my epilepsy colleagues were actually redeployed into other areas, and actually I was actually asked if I would go back into intensive care as well. So a lot of epilepsy nurses were actually taken out of what they would usually do to go and support elsewhere. So a number of procedures were stopped. That included EEGs, scanning, any non-essential they classed as. And then I think what the NHS particularly realised was this wasn't a short-term thing of a couple of weeks. This was going to go on, and they knew that they had to plan other ways, and that's when they started looking at other ways they could do it. So the likes of Zoom, Teams, accessing appointments on a virtual basis, and that's what they've been doing now. Also, nearly a quarter of people had trouble getting their medication during lockdown. There were issues, and unfortunately Brexit was also had just occurred as well, so we already had concerns around medication problems then, and then going into isolation. And in our case, we were okay from a point of view, but any of our parents that had their children at home, and we were sending their prescriptions up to their local pharmacist, they didn't actually stock that medication, so that became a bit of a problem as well. So looking at strategies around how to manage that. And a lot of people with epilepsy living with the condition were worried about actually catching coronavirus and how that would impact on them. We know that people who have seizures, it can be worse when they have a temperature, and we know that that's often a trigger for seizures. But what we have found, and what evidence has shown, is young people tend not to get adversely, the majority of them don't get adversely affected by COVID-19, and actually people with epilepsy are not at any more risk of suffering adverse effects from COVID-19. So, but there's still the worry there. You know, anybody can worry about catching the virus. So what has been set up at Young Epilepsy, I hope this doesn't feel like some sort of Young Epilepsy advert, but I work here, and so I know a lot of what's going on there. Is Young Epilepsy, before COVID, we weren't preparing for this, developed this called The Channel, which is a formatted area. It's an app, and it's full of really useful information that's been devised by young people and specialists all around, like really useful advice on many different things around medication, and it's for anyone who lives with epilepsy for whatever condition, and also their family. So it gives them lots of really handy tips and ideas. There is the usual first aid, more information about epilepsy, different things about other treatments, so such as vagal nerve stimulator, the diet, deep brain stimulation, life hacks, which I think people find really important, and then also things about financial support, different ideas around like going out, parties and drinking, and all of those sort of things that sometimes people are reluctant to ask, but there's often a blog on there that you can, and we've had like 7,000 visitors already since March. So it's really good, and it's a constantly developing channel, which is really useful, and people have found it very beneficial. So I would suggest that with the whole stress and the anxiety that COVID has brought, the lockdown and the worry, for young adults, this is a fantastic forum for people to go on to, and to talk to someone who's probably going through very similar things that they want somebody around their own age that they can talk to, not their family, but somebody else who might know what they're feeling and how they're feeling. So I do definitely advocate it's a really useful tool. From a point of view of epilepsy, I can't kind of get away from the fact of talking about risks and the real risks that are associated with having seizures and living with epilepsy. But I think a big thing is not to be negative, to be aware, to be open and talk. I think that's really important. And don't ignore risks. I will say never ignore risks. Take positive steps. So get advice, get some understanding around, you know, look out there, see what's going on, get as much information as you can. Very important, the regular medical reviews, and at the moment they are virtual, and I do feel that this virtual is probably going to be the norm unless you need a physical examination. And I think we have to look at that in kind of quite a positive way. And initially when it happened, I was a bit, oh God, all virtual, it feels like we're a bit like robots, we're not seeing somebody in the flesh. And I think it's a bit of a positive and negative. I feel that they've been very positive in the fact that you get to see your specialist usually. They can fit more people into a clinic. They're possibly shorter. You haven't got the waiting around, which you could be in a clinic waiting, having run epilepsy clinics in the past in hospitals, you could be waiting 2 hours for your appointment, whereas you usually are seen fairly on time. You often get to see your specialist or one of their team, and you get the information that you need there and then. And I find that you're actually getting the information from your specialist, and you're not maybe missing out some of those key things. Also, other people can join. So I've been able to join clinic appointments for my patients, which I wouldn't necessarily have been able to do before, because I couldn't have travelled up to London to see their specialists with them. But now we can all join together. So that's been really important. So there's a lot more joint working, which can be really helpful. And also, say if somebody's living away from their family, but they want their family to be involved, they can actually join as well. So I think that that's a really, that's a big positive. However, also I run clinics, I run VNS clinics here, and I physically can't do that over the internet. It's impossible. I have to see a person. And I do think that there is nothing more powerful than being face to face with someone and reading body language. And you'll start on part of the question and you think, oh no, that's not what they want. And you can read that on somebody, whereas over the internet, I'm sure you can read the fact that I'm quite nervous. But other than that, you can't get out of people exactly what they need from a clinic appointment. So there are positives and negatives, but I do feel that we are going to have to bear with this, and we are going to have to get used to this. And this is something that will go on for some time, but embrace it. You know, they're not all filmed, so they're not there for people to see for ages to come. They are your time to be with your specialist, and they still then write your clinic letters, so you'll still get that. They'll still liaise, and actually feel positive that actually they've probably got more time then to liaise with other specialists as well and ensure that treatment's followed up. And another thing is self-monitoring in between your reviews. That's really important. Documenting seizures is paramount to ensuring that you've got the right treatment. Don't feel that you have to label the seizure type. Just describe it. Just say everything you see. And I always train my team is go from top to bottom. So say, what were they doing with their head? What were they doing with their eyes? What were they doing with their face? Were they making any specific noise? Act it out if you have to. What side of the head did they turn? What side did their eyes go? What did they do with their arms? Did their arms do the same thing, or did one do something different than another? I'm acting this out and you can't even see me because there's only my head. And the same with their legs. What was their breathing like? What sort of noises did they make? Did they change colour? So go through all of that, and it's if possible, and you have the permission of the person having the seizure, obviously get it before, is film them. And again, now with remote access, you can send that to your specialist and they can actually physically see that. And that really helps, because originally with a diagnosis of epilepsy, you might have been told this is the type of seizures you have. But then over time, your seizures can progress and they can change. But you might still be calling them that same seizure type. But different medication work for different seizures. So it is really important that we get to know what type of seizures a person is having and how they can be managed, and are they on the right treatment. And even to this day, I meet people and I'll be told, oh, they're having this type of seizure, this type of seizure. And actually, when I witness the seizure, it isn't that type of seizure. It's progressed, it's changed. And actually, their treatment then needs to progress and change with them. So it's really important to record and describe seizures if somebody is there. Seizure diaries are fantastic. There are lots of apps now that are out there that people can use on their phone. They can track their seizure types, make nice graphs, put medication reminders in, looking at risks, and there are monitoring apps around. So on here, looking at the leaflets that are now available, lots of people still like a paper copy of something, and I do think that's important. It's quite nice to sit there and read, but also you can get those on devices now. Epsom is a really good app, and that really helps in terms of tracking risk assessments. And then there is the Sudep and safety checklist, which is really important for everyone, and it's a free tool to look at. So I do definitely advocate get as much information as you can. And then just some of the things that I always talk about and try and get people to remember is, with seizures, everybody is unique and everybody is an individual. And I think sometimes people forget that. And I'm sure you understand this with TSC, is you become a label of that condition, and you certainly aren't. You are an individual, and everybody's seizures are different. We might have, there's over 40 different types of seizures now, but we do categorise them into generalised and focal. And then we have the 5 that everybody thinks of, the tonic-clonic, the generalised seizures, but each person manifests those differently, and they are unique. So everybody's seizures look different and are unique to them, and they affect them very differently. Somebody might have a 2-minute seizure, but that means that they will be sleeping for 24 hours, 12 hours afterwards, you know, whereas other person can have the same seizure over that amount of time but be up and getting on with things straight away. It is so unique and individual, and don't ever compare people with their seizures, how many they're having and what type of medication they're on. That's another thing that I do find people compare. Oh, well, I've got this type of medication, or I've tried this. Again, it depends on the seizure type, the amount of seizures you're having, your individual circumstances, what is available, and also a lot of the time what your specialists have found have worked in certain situations, and it's their expert understanding and knowledge that really is key. Always think of risks. It's horrible to have to think about the potential risks involved with epilepsy, but you must take them into account. So the obvious ones are bathing or showering, never left alone in a bath. We always recommend showers, and preferably showers in wet rooms as opposed to shower cubicles, because there is still a risk of drowning. Other risks are Sudep. There is a significant risk of Sudep with the more generalised seizures that you have, especially if you have seizures at night. That can increase your risk of Sudep, and making sure you take the medication on time and following the direction of your specialist. That is really, really important. Alcohol and other drugs can interact, but still make sure you take your prescribed medication. I have a number of students who would say, oh, well, I'm going out drinking, so I'm not going to take my meds. No, still take your medication and discuss with your specialist. We never ever advocate just stopping meds. With anticonvulsant medication to stop seizures, it always starts slowly and is increased slowly and comes off the other side slowly if they have to decrease it. Going in too quickly or coming off too quickly could induce seizures as well. Think about when travelling abroad, different time. Oh no, I say that now in COVID, not many people are travelling, but there is the potential that more people will over time. But it's a common thing that people suddenly get abroad and think, oh my God, it's lunchtime, but really I should be in bed. How am I going to titrate my medication? And we often look at planning a few days or weeks in advance, and slowly titrating the meds times until you get into the time of where you're going to be. And again, do the same when you come back. It will take a bit longer, but it does work and it does help, because that can prove very difficult and can actually unsettle quite well-controlled seizures. Medication brands. I always advocate that stick to the brand that you started on. There is literature out there now from the government around certain type of meds that have more bioavailability and can be changed brands. So if your GP doesn't prescribe the brand that you are on, the pharmacist will give you whatever of that medication that they have there. And it might not be the brand. So say lamotrigine as Lamictal. If you're on Lamictal, you want to stay on Lamictal, your GP has to prescribe it as the named brand. Otherwise, you could get any version of lamotrigine. It should be the same drug, but we have known that some don't respond as well to that particular medication. So it's important, but if you start on a particular type of lamotrigine that's not Lamictal, you can stick to that one. So it is very important. I have seen changes in seizures due to brand changes, and it is something, if somebody loses control of their seizures, it's often something that we look at. So think about that. There is literature on the government website about the types of medication and the tiers that they say this one can be changed, that one can be changed, or that one can't. In terms of medication and not being able to source it and getting hold of it from pharmacists, that can be a real worry. So again, my advice in that respect is plan. Make sure you've got a good stock. Make sure you've got the ability to get stock. Work with your team, work with your GP, work with the pharmacist, and give them plenty of notice so they can order it in. Order the type and the brand in that you need. The government are being really good at sharing if there is problems with a particular medication. The manufacturers of drugs are actually contacting people very quickly and making them aware if there's going to be a sourcing issue of particular types of drugs. We've had that with phenytoin, where we've had problems being able to source phenytoin, and they actually give you schedules of how to change over to the next option, and that's been really useful, and we share that with parents. So make sure that you've got good relationships with your pharmacist, because they will share that with you and be able to talk you through how to do that. What is the change? If there's a change in dose, how is that going to be worked? And we have done that on a few occasions with some of our students here, and touching wood, as I touch a lot of, we've not had any problems, which has been really good. Epilepsy and learning. There are lots of resources available, and if you were to look on the Young Epilepsy website, we've done studies again around epilepsy in school and how it is managed. There's a chess study where we looked at learning and the effect epilepsy has on learning, and there are a number of resources out there. So it's really important that, again, you work with your school and you work with your local team and try and put as much support in as possible. Make sure that staff are trained and know what to do, what type of seizures there are, what triggers seizures, and how to manage them. And a big thing is encouraging teenagers to take control of their own health. That for a parent can be so difficult, and I do spend a lot of time with families talking about that. You want to wrap them in cotton wool. Watching a seizure is unbearable with somebody you love, and you want to take control and you want to look after them and you want to make sure that they don't get it. But if you don't encourage them to take control of their health, you're probably going to get some sort of rebellion as well, and you'll often find that they might not be as compliant with their medication, which then increased risk. So it's encouraging them at what point can they take on some more of control over their health. We work with our students here and get them to come and join in clinics on their own things like that, we obviously then ask for their permission to share that with others, and that works really well. And you know, some might not be able to take on very much, but just giving them that time as well where they can actually sit with their specialist on their own and have a few minutes, or you know, half of the clinic where they can talk quietly on their own with that specialist is really important. And again, utilize specialist support. That is paramount. There's lots and lots of information out there, and don't be afraid to use it. Don't be afraid to ask questions. There's our helpline there, which is open, you know, during the week. Epilepsy Action is fantastic, and they have amazing resources. They have a really good parent training, online training course, which is fantastic to access. You don't have to do the thing all in one go. You can come and go as you please. It goes through all the different types of seizures, but it's a really good resource on everything around epilepsy. And I often signpost our families to it for their carers that they might have, for their carers to actually do some online training, and it goes through everything with them, and it saves the families actually having to do the training as well. Specifically, it gives them something else, another resource to look at, and it's very, very useful, and I think has been really useful for other people. And then it's utilising nurse specialists, utilising external group support, and speaking with people. I can't say it enough. I do lots of it. I spend all day talking. It is so important. Talk, get your voice heard, and get your questions answered. If something is worrying you, don't be afraid. There will be other people who are worried about that same thing. So looking for helplines, support groups is really paramount and very, very important. So that was kind of me, and as I said, I can really talk really quickly and get things done very quickly, but what I thought would be good is to actually answer some questions if you have any specifically around this, and if I can answer them. So I can stop sharing, can I? I don't know if that's going to be any better or worse.
That's fine. If you stop sharing, Lisa, thank you.
Done it.
Thank you for that. That's great. Really informative and interesting. So as Lisa says, if anyone has any questions, now is the time. So if you want to put any in chat or give a wave or whatnot. But in the meantime, I had a question actually, Lisa. I know you were saying about empowering teenagers to manage their own health and things like that. Have you got any and maybe like tips or case studies perhaps with anonymized names and things about how you can do that?
Yeah, it is a really hard one, and I think parents really struggle with empowering their child. I always do the giving them their own time in clinic, and agreeing that in advance, agreeing that with the specialist that you're seeing. And often I start with the nurse. I think that young people can talk to a nurse. I feel they feel less fearful, although we can be quite scary at times, less fearful of a nurse than a doctor. And so that's often a start, is to let them have a little bit before the parents then come in. I don't know if you still. Oh, now I'm back again. There.
Yeah, sorry, it went off for a second.
I did. I stopped. Everybody else stopped. I didn't, but I think I probably stopped for all of you. So yeah, that's a top tip I have when I've done clinics before, is giving them time with the nurse, getting them to read lots of the information. Remember, a person doesn't usually know what they do in their seizure. They've never seen their seizure. So actually, if they witness somebody else having a seizure, that can be really scary. So it's talking it through with them, giving them lots of literature. I can't recommend the channel enough. I've spoken to lots of, we have lots of reps, young reps on there who've got life hacks that I wouldn't have even thought of. But because they're living with the condition, they've come up with these ideas around, you know, it's things like clubbing. We can't ever imagine clubbing at this moment in time, but in time we will go back to that, and life hacks they've had so they can go out with their friends, shopping, best places to go, ideas, and they put different ideas up on there, which is really useful. So again, I would do something like that. For me, clinics are a really good way, getting them to phone up helplines, getting them to log on and joining other support groups and asking questions. That is really good, and being open and honest for me.
Okay, lovely, thank you. Very, very, very interesting. So we've got a question from Nick in the chat. So I'll just read it out, but you might be able to see it as well,
yeah.
Lisa. So my 3-year-old son was diagnosed with TS following onset of infantile spasms at the age of 7 months. He was started on vigabatrin, and he has not had a seizure since, thankfully. That's good news. He is now 3 years free of a seizure, which is fantastic. What are your thoughts about the right to stop vigabatrin?
Okay, when you start with infantile spasms, vigabatrin is a brilliant drug to use, and does work extremely well. However, there is a significant risk of infantile spasms then returning later on and becoming more generalized seizures as well, and manifesting themselves slightly differently. Depending on your specialist, some will say just continue on it. Others will say after a 2-year period of being seizure free, as long as you haven't seen anything. And I think sometimes that's where the problem is. You might not have necessarily seen something that has occurred, is very, very slow withdrawal. And I would say extremely slow. Whatever they say, kind of go half on that. Take it very, very slowly. If at any point you're concerned, stop, give it a bit longer. I don't think there's ever a need to rush a withdrawal. I really feel take it very, very slowly. But the fact that you've been seizure free, you know, for that amount of time is extremely positive, and I would always be, you know, really positive on those small wins, really. But be cautious that seizures could recur later on, and so always think about risk and managing it and keeping safe.
Great, thank you, Lisa, and thank you, Nick, for the question as well. Is there any more questions from anyone from Lisa? As I say, oh, Marie, hello, Marie.
Hi, thank you, Lisa. Very interesting presentation. Thank you. My question is, for many of us, our loved ones are on a host of different drugs. What, in your opinion, is the optimum amount that they should be on? Okay,
well, as I'm sure you're all completely aware, NICE guidelines state that you should be seizure free on the minimum amount of drugs. So you start off on one, get up to a good therapeutic level. If you're not seizure free, then add in another one. If, however, you're not seizure free on those 2 medications, you're unlikely to be seizure free, very unlikely, on any more that you're adding in. However, it is a really scary process, because every time you add in a drug, you do see a little bit of benefit. It might be that one type of seizure might be slightly shorter, or another type of seizure you might not see as frequently. So you never want to lose that little bit of a gain. And so then you add others in, and then you add others in, and before you know it, you're on 5 meds and thinking, I'm still having seizures. So I think you need to be very truthful with your specialist and work with them and say, okay, which one of these work? Look back, and I say this to all my new patients that are starting, is keep a diary, because you could be looking at 10 years down the line and you think, oh God, when did I start that? And actually, did that have a benefit? So I would suggest track that. So write down when you started, what level did you get up to, and what was the benefit? And then look at which one had the most benefit, and that was the one you keep. And then slowly work with your specialist. I would never advocate taking meds off yourself, and say, actually, could we come off one of those? Or, you know, I don't think that had a benefit, and we need to come off that and try something else. So yeah, so NICE guidelines is 2 or more. You know, 2 is the max, but people are on a lot more.
Yes, we're currently on 5.
Yes.
Another one was going to be added, but just pre-COVID, we were weaning off one of them to add another so that we would still be on 5. But as you said, it's the little bit of benefit on everyone that's been added, and not wanting to go backwards then, and hence the adding on more. But another question, if you don't mind, what effect has the COVID shift in resources and attention had on the potential for Epidiolex being accessible?
Yeah, well, Epidiolex is still it is licensed for those with Lennox-Gastaut and Dravet syndrome. It's only in certain centres, so it's kind of like a tertiary centre. So King's up in London Street, the National, all can prescribe it for children and young adults with Lennox-Gastaut and Dravet syndrome. I know that licensing is currently going through for TSC as well. And I spoke to GW Pharma, who produce Epidiolex, and it is on it. It is going through, so that is definitely a positive in the future, and I don't think will be that long. And we've actually been really fortunate, because to get your Epidiolex, you used to have to go up to hospital, and it's quite a drawn out process. You have your specialist appointment, you have your dosing schedule, and then the pharmacist is there to hand over the medication to you. And that wasn't possible in COVID. So they actually have been couriering it out to people. So they haven't missed their drugs, they haven't missed the dose, which has been really good. But they are now going back to the appointment schedules again, which again is really important, because they need to see what the benefit is. They need to see that they're on the right dose and the proper monitoring to manage the blood work and any potential side effects. So it is important. But to me and the children that I look after who were on Epidiolex, it actually didn't affect, luckily, because they managed it. The teams managed it extremely well. Yeah.
Thank you, Lisa.
Lovely, thank you, Lisa, and thank you, Marie, for those questions. Very, very interesting. So we've got another question from Nina that's just come through. So I'll read that. How effective has everolimus been in controlling seizures? I imagine a lot of people listening and watching this will be quite interested in everolimus. My son is 22 years old on vigabatrin and brivaracetam.
Yeah, brivaracetam. Yeah.
And the consultant is thinking of trying everolimus.
I've had a number of the children and young people I look after been on everolimus, and I've seen mixed results. I've had some that it's been extremely positive, and others there's been no benefit whatsoever. And I think with any anticonvulsant, it's exactly the same. For some, an anticonvulsant will work extremely well, and then for others, there is no benefit. And I think if it's available, I really do feel, give it a go. The teams that manage everolimus are brilliant at what they do. Throughout this whole COVID situation, they've been fantastic at supporting the patients and their families on this, because it does add additional risk because of the drug it is, and they've managed that extremely well. So for some, it has been extremely beneficial.
Thank you, Lisa. We've got another question now from Rob as well. Thank you, Rob. So Rob says, my daughter doesn't suffer from convulsions, but absence seizures. She is 12 now. Are there any trends on how this develops? She is on carbamazine, which is working well.
Yeah, that's brilliant that her carbamazepine is working well. Some people just have one type of seizure, and that's what they have. They will just have absences. Absences, although they don't appear as scary or as worrying as a convulsive seizure, during that absence the person is unconscious, and so it does have a significant impact on their learning, their development, often behaviour, because they miss things that we don't know that they've missed. And they can get quite frustrated, quite angry. I had a few people I've worked with who have such frequent absences, and they're often missed because unless you're staring straight at them, you don't know they're having them, that they can't watch TV because TV doesn't make sense, because they're having such frequent seizures that they're missing scenes and they're constantly trying to find where that film left off because they don't know they're having seizures. So she may continue just to have absences, but it's very important that people around her understand that, because during an absence, you're not aware of what's going on around you, but often you could still walk around, and that puts additional risk on a person. So it's really important to keep them safe, manage risk, be aware. And also I find working with a lot of our client group is don't constantly go, oh, did you miss that? Did you miss that? It's learning to adapt to them and managing them. And so just repeating things, but in a way that doesn't feel like it's repeating, and because they're not going to have missed everything, but they're going to have missed important bits. So it's reminding them. So with schools, what I always suggest is if you have absences, is get them to give you handouts, get you to have things available that they can rewatch or look at, because then they can, the bits that they would have missed, they might be able to pick up at another time.
Yeah, it is quite scary at times, but so thank you. Thankfully she hasn't had anything, but I think it's looking out for that slow progression back, like you say, the slight missing thing.
I'll just say one more time, if anyone does have any questions for Lisa, do feel free to put it in the chat box, but otherwise we can call this meeting done. So I'll say once more thank you to Lisa. I'm sure we'll have Lisa back at some point. I've got a feeling, judging by the popularity of today's meeting. And yes, so keep an eye out for the recording as well, that will go on the website and social media and whatnot. And yeah, do please feel free to share it with other people as well. So it looks like we're not going to get any further questions for now. But yeah, do send them across if you have any questions to me. So big thank you to everyone, and I'll say goodbye now. Thank you. Bye.